All right. And then let me pull up the slides. Okay. Hi, MK.
Good day.
Good day. Okay, so we're here today to talk about the COVID vaccination effort for people experiencing homelessness and people who use drugs. We'll talk about where what organizations are a part of the data that we're talking about. So that way everybody's kind of on the same page there. Our goals for our time together is celebrate all that's been done, educate and align on current efforts, educate and align on the strategy moving forward, and gather feedback, questions, and next steps on where we go from here. Does anybody have any feedback on the goals of our time together? Hearing none. Okay, and if you're on your phone or anything like that, feel free to put in the chat too, so we can make sure to align our time towards what folks are looking for out of this space. So in terms of the partners that we know that there were an enormous amount of different efforts that went on to support vaccinations, but what we're going to be talking about today is 3 different sort of collaborations where folks either shared data or worked in partnership with Sacramento County Public Health. So the first one is the SSF Encampment Collaborative, which ran from February 1st, 2021 to July 31st, 2021, where Sacramento Steps Forward partnered with a couple different CBO partners with Sacramento County Public Health. Those include CLAP, Sacramento Homeless Union, Humanitarian Action Network, SAC Covered, SAC Soup, Show Up SAC, South Sacramento Homeless Assistance Resource Team. And so we're going to have Sacramento Steps Forward a little bit later in the presentation, talk about where they are with the collaborative and where they're going. But these were some of the folks that during that time frame we did partner with specifically on vaccinations for encampments. Is there anybody on the call that wants to add to that description?
Hi, Liz, this is Nika.
Yeah.
I have none to add. That was great. Thank you.
Okay, cool. Thanks, Nika. There are also health partners. So Elica Mobile Outreach. I think Dobby's on the call today. So shout out to Dobby.
Yes.
Efforts from Dr. Carter, Wellspace Health had a street nurse, had a street outreach team that worked with us, and then Dr. Mackey and team and Dr. Oshida all were sometimes they worked with us for 1 week, but did a lot of great work during that time. But these are the different health partners that either we partnered with closely or they shared with us information, so that way we could make sure we're not duplicating efforts. And then Sacramento County Public Health ran direct events in partnership with CBOs from mid-March 2021 to the present. And the 3 main partners that we've worked with as a part of that process are Loaves and Fishes, Harm Reduction Services, and SANE. So I'll pause there to see if we have any additional information from folks that worked in those areas that they want to add. Okay, sounds good. So just an overview from all those different partners there. We have provided 2,594 COVID-19 doses. It's probably a little bit more because this was data that I pulled on Monday, and I know there was a very successful Loaves and Fishes vaccine event. And then 193 flu shots. And then you can see a little bit about what the numbers look like. So there has been a decrease in the numbers from just December to February, but I know that doesn't tell the whole story. So yeah, but a significant number of COVID-19 doses that have been provided throughout the partnership's history, which is amazing. I'm just going to open up at the end of each slide. One, because Gabby couldn't join us and she was going to provide some additional context. So if there's anybody who wants to provide additional context or information about this narrative.
I think the patterns have been fluctuating since kind of the start of vaccine availability, where like as each variant becomes more present, we see vaccination rates go up, and also like increasing vaccination rates with incentives as well, which I think we're going to talk about later.
That's right. Thanks, MK.
So Liz, does this include like the county and city ran motels? It's like, are those part of these numbers?
Yes, so I would say most of it is. So I checked in regularly with the teams that were going out to vaccinate at the motels, but I wouldn't say it's 100% inclusive.
And just kind of to add into your numbers, Liz, for Ellicott, during the 2021 year, we gave 1,161 COVID vaccines during the 2021 year. And so far this year, we have done, we've done 96 so far for January and February.
Awesome. Thanks, Davi. And we did include some, but not all of Ellicott's numbers into the data that we have here. So that'll bump that up quite a bit. So thanks for sharing that.
Yeah, one more point too, just for clarity, is that yeah, these numbers come just from the events that were on the previous slide, and so this isn't like accounting for like any of the big like mass vaccination pop-ups, or like if someone got their COVID vaccine from their primary care doctor or like the county primary care clinic, et cetera, et cetera, et cetera. So this is just the vaccines that were given with the partnerships from that previous slide.
That's right. Great. Okay, so in Davi and Wellspace we're submitting data to me around where they were going and how many vaccines, but due to various factors, like it wasn't 100% complete. And so it's great to hear about what other folks are doing too. Okay, so we have next slide. Just to give you a sense of what it takes for the vaccination team that's serving people experiencing homelessness to have events, both in encampments as well as the standing events. So we do have a coordinator, Gabby Ortiz, that is working with Sacramento County Public Health, that's supporting the coordination, community engagement, and some administration associated with the different events. There's a medical provider. We have Gloria on the call. Thank you, Gloria, for all your great work.
Hi.
Hi. We also have a medical assistant that's now associated with the program. And then, of course, the great work of our community-based organizations that we partner with, such as Harm Reduction, Loaves and Fishes, et cetera, to support those events. So I know that Rachel and Lisa, who are on the line from Sac County Public Health, are going to talk a little bit about the transition into the IAP, Sacramento County's IAP program, which may modify staffing as we've seen such successful events in partnership with our partners. But this is what it's taken so far to really run something well. Is there anything that folks want to add here? Okay. So as MK mentioned, we have some sort of core partners as a part of the collaboration, Harm Reduction Services, SANE, Loaves and Fishes, and wanted to give you a sense of when those standing events are, so that way if you have individuals and partners that are interested, they can promote that. And then how many vaccines have been given so far, again, just in this collaboration that we're talking about today. Any questions about that? Woohoo! Okay, so the impact of incentives. Leanne, I don't know if you are still with us, if you want to speak to what you've seen. I'm just pulling up the data that I have on our tracker.
Yeah, I mean, the incentives have made all the difference. And I mean, I would say the incentives and, being able to have MK here to answer people's questions. So having that available has been really helpful as well. And I think the two of those together is what has worked the best. I actually just read a report about this yesterday. But you know, I mean, we're getting folks who like want to get the vaccine, you know, maybe have some questions that they want to ask, and then like are willing to like wait for the incentive. So, you know, HRS was providing $50 Visa gift cards for several months. And that's when we were seeing those really high numbers between like 25 and 35 vaccines every week. When we didn't have the incentives, the numbers significantly dropped, severely dropped. And now County Public Health is providing a $30 incentive right now. So we are seeing the numbers go back up. I left before we were done last week, so I'm not sure exactly how many vaccines we did last week. But I would say that, you know, the incentives combined with like the ability to like get their questions answered and talk to a physician have been what has really made it so popular here.
Awesome, thank you. And then we just have another example here with Loaves and Fishes. MK, I don't know if you have anything to note around that. I know you've seen the changes as well.
Yeah, absolutely. I mean, when we started to, exactly, Leanne said it best, incentives increase vaccination rates, as like they only increased from here. So yesterday, you know, Gabby told me there was 70 vaccines done. And I think that is a combination of incentives, but also having the IAP folks there who are able to like meet the capacity.
Awesome, thank you. Okay, so I am going to pass it over to MK.
Yeah, I'll be brief. This is a report that was done by someone at the UC Davis undergrad campus, Dr. Ryan Finnegan, that looked at folks experiencing homelessness and surveyed at a couple different sites around town: Lowe's, First Step Community, Safe Grounds, Midtown Hart, and asked how many people have been vaccinated, both fully and partially. And as you can see here, 58% of the sample size in this survey were fully vaccinated against COVID-19, and 65% were at least partially vaccinated, which isn't far from Sacramento County rates at that time. Next slide, please. And this is an excerpt from that report that just kind of talks about how closing the vaccination gap was some of the work, some of that movement was possible because of these community partnerships, like with Sacramento Heart, like with Loaves and Fishes, like with HRS, like with the Homeless Union and Soup. So by like building partnerships within the community and decreasing barriers to vaccines, which we started, you know, intentionally doing with Sacramento County Department of Public Health in March, it's led to increasing vaccination rates. And is this me too? Great. So in conclusion, and why be intentional about decreasing barriers to vaccines is to reduce inequity in vaccine access. So we know it is more difficult for people experiencing homelessness, people who use drugs, really anyone who is marginalized, they have increased barriers to care. And so by decreasing those, we're able to increase vaccination rates. This also helped, I think, Sacramento County like build trust with people who are living outside by showing up consistently at like Loaves and Fishes and at HRS, and now it's Sane. By having that consistent presence and reliability, it allowed for trust building, and with partners too. So like with Loaves and Fishes, HRS, etc. Like it's great to be able to go to Lowe's and harm reduction services like you know, once a week during this time, and like be able to talk and strategize about how to improve care for folks. Great. And I think this just goes to show that by collaborating and we can have improved outcomes. And these are some quotes from folks in the programs. I don't feel like I need to read them out loud. I'll let you all read them. But really just emphasizing trust building and partnerships.
I'll just leave that up there for a second and pause as well for folks that have additional comments or questions from the last couple slides.
I know this is based on like the partnerships and stuff, but is there like data about the encampments? Because we know like generally people who will like go to like services like Loaves and Fishes or Heart. I guess this is going to sound really generalized, but that they may seek out that type of treatment of vaccinations. But like, what about like the encampments that we know don't? And I've been kind of distant from this project for a while, but do we have like data showing like that kind of?
Mm-hmm. Yeah, that's a great question. And I know that it was one of the reasons why we focused on the SSF effort where we're going out to encampments to kind of focus similar types of teams and outreach and to folks that we anticipated would not be able to come to the Loaves and Fishes or harm reduction events. And so that time period I know was more limited than folks would have liked in terms of that effort being active. MK, did you have anything you wanted to add to that? And if I pull you into the spot, feel free to be like, stop looping me in here, Liz.
No, you know, I'm always here for you, Liz. So yeah, no, we don't have that data. That, I mean, it is hard to get data on folks who are not accessing services. So I mean, I think like it is for 1,000 different reasons. I mean, we do have data on how many vaccines we did like on foot outreach into encampments. We have that data, but we don't have like how many people, you know, we don't even know in Sacramento how many people are living in encampments. So we don't even have a baseline. We don't even have a denominator really, a denominator to work from. So it's kind of impossible to get that data.
Thanks, MK. John? Oh, you're muted. Still muted.
Here I am. Crystal, I can probably answer you anecdotally. As the host of the Midtown Heart Respite Centers, I'm telling you that probably we do a straw poll basically every couple of weeks. And on Fridays, of the 30 people I have there, maybe 2 people are vaccinated. So even though they're coming to the Heart Respite Center, they're not necessarily, they didn't take, we actually had a vaccination clinic on site back in the fall, and I only got 4 takers. And so I would like to think that when they come to these things, that they'd be more welcome, but it hasn't happened at ours.
Thanks, John. So I think that leads nicely into the Sacramento Steps Forward vaccination strategy update. So Nika, I'm going to go ahead and pass this slide over to you. If you are speaking, you are still muted.
It looks like she just fell off.
Oh.
No, she's back on.
Oh.
I see her on the call. Nika?
What?
Hi, everyone. I'm sorry. I got disconnected.
Okay.
I'm back now. Can you hear me?
Great. We can, loud and clear.
Amazing. All right. Let's see here. Liz, I see the slide. Thank you so much for bringing that up. Okay, so after careful discussions with the Center at Sierra Health Foundation and our Sacramento Steps Forward leadership, we have decided not to proceed with our COVID-19 unsheltered outreach. And so the COVID-19 Community Health Project, or CCHP 2.0, came with new administrative requirements and obligations. And so this has posed several challenges for wholly approving our project proposal. And so while we are not proceeding with CCHP 2.0, we are making available several but limited resources to you to support, to continue supporting your community outreach efforts. And so this includes toiletry kits, blankets, COVID-19 testing kits, Narcan kits, COVID-19 educational materials, sanitizers, masks, and more. I would like to emphasize that this is a first come, first served opportunity. So if you are interested in these resources and would like to make arrangements, please email me at the email on here on the screen at kdari@sackstepsforward.org, and I would be happy to help you in any way.
Thanks, Nika. And those are specifically for folks that are going to be doing vaccine events for people experiencing homelessness, or just anyone can reach out for this as a need for their outreach more generally? That was a question.
Yeah, that's right.
Oh, it's all good. Okay, so what's the answer to the question?
And this is to support general and ongoing efforts that are happening currently, just to supplement that work. And as I mentioned earlier, it is a first come, first served opportunity. And so once these supplies are gone, we won't be able to guarantee when the next supplies will be available and how much will be available.
You got it. So just to make sure I'm crystal clear, just for vaccine outreach, or any type of outreach can email you?
Vaccine or any type of outreach
So
to support any
outreach.
of those efforts. Yes.
Okay, got it. Thanks, Nika. Any questions for SSF? Okay.
Yeah, I do.
Yeah.
Just because I know there was a couple meetings with community partners who aren't necessarily on this call about CCHP 2.0. Is there going to be outreach to them to let them know about the status?
We are going to be sending that official notice to all of those partners. And so those are who we're planning to return and the new partners who are interested in participating in the effort.
Cool.
Sounds great. Thanks, Nika.
Mhm.
All right. So next we have our public health team. So I will pass it over to Lisa and Rachel.
Hi, everyone. My name is Lisa Tarko. I'm a program coordinator with the county. I'm actually a pharmacist as well by trade. So I've been a vaccinator in the field as well.
And Lisa, if you just wouldn't mind speaking up just a little bit more.
Okay.
Thank you so much.
Yeah, let me just turn up my volume. Okay, let's try that. Is that a little bit better? Okay.
Yes, so much better.
Okay, great. So in case you missed that, I'm a pharmacist and a program coordinator with the county. So I help with our planning team to decide which locations we go out to most of our county clinics. And then I oversee the teams that go out to all of the different locations that we serve. So I've been working with the teams that go out to all of the unhoused locations that we do the loaves and fishes, harm reduction, and SANE. And our work with them is very collaborative. We're open to suggestions. We're open to making things as easy as possible. And so we're constantly trying to improve the process. So hopefully now that, our involvement in these programs, we can continue to grow and make them as successful as possible. So obviously, reaching out to the unhoused is just one aspect of what we do. We do a lot of clinics going out to different locations within the county. We also serve some homebound. And so one of the things that we'll be working on is partnering as part of the larger program, just partnering with schools, trying to reach families, knowing that schools are generally a safe place for whole families to come out and get everyone vaccinated. We'll be reaching out to any long-term care centers that aren't vaccinated, any people that might be homebound and not able to get out to our clinics. We have services. We'll be partnering with some of the refugee agencies and resettlement groups to help vaccinate the Afghan refugees. So we're working with lots of different partners and lots of different groups to try to get out there and get as many people as possible vaccinated. So in terms of strategy, Sacramento's rates are about pretty much consistent with the state overall, but obviously there's room for improvement. And in terms of booster rates, that's one part where we feel that we can really, so one thing that we're going to work on is improving booster vaccination rates, and also overall vaccination rates, especially for those people that might be underserved in the Q1 or Q2 quartiles within our county. We're also focusing on pediatric vaccinations, especially the 5 to 11s. So they are the newest group to get approved, and there's just a huge gap between those people that are in Q1 versus Q4. So Q4 areas, rates have just taken off for this group, and they're just lagging quite a bit actually with Q1. So we definitely have to focus a lot on our pediatric population. Of course, we want to keep going with the 12 to 17s, and that's the group that is really lagging with booster vaccines. And then the next group to get approved will be the 6 months to 4 years. And so probably within the next couple of weeks, we'll see that vaccine come out. Especially for pediatric vaccines, we know that most people trust their primary care doctor. And so that's, primarily where they're choosing to have their children vaccinated, whereas most adults might reach out to a pharmacy or, even a community clinic. Just realizing that for those patients who don't have a medical provider, we're trying to fill those gaps and just provide a safe space for the entire family to come out for all of the different age groups. We also recognize that Black and Latino rates are lagging behind the state average. And so we have partnerships with other community groups to try to increase the rates in neighborhoods that are most hit. And also we understand that, working with COVID isn't necessarily going to be something that goes away quickly. It's going to be more of a sustained effort. And so the governor has come out with something called his Smarter Plan. I'll talk about that in the next couple slides, but and also incentives going forward. So we also really hope that having our staff involved going out to these clinics will provide a little bit of consistency so that the community can really trust us and get to know us. And we do have extra resources devoted now. So I've decided to send out more nurses, more medical assistants who are there and hopefully provide a little bit more of a relaxed atmosphere. We have tents set up now at Loaves and Fishes so patients can be sheltered from the sun and just sit down while they receive their vaccine and then wait afterwards. Our staff is really adept at answering questions about all the different vaccines. We have different literature if they want some more handouts. The other thing that we'll be providing is Pfizer vaccine at all of the clinics. So I know most of the clinics were just running with Moderna and J&J, which are for 18 plus only. But we will be offering Pfizer at all of our clinics. And one advantage is that the interval between the first and second dose for Pfizer is only 21 days. So hopefully we can capture more of those people coming back, in a shorter time frame to get their second dose. Also knowing that there's going to be an incentive waiting for them as well. You could go to the next slide.
And Lisa, can you explain to people, what does IAP stand for?
Oh, okay. IAP is the Immunization Assistance Program. It's just the name of the vaccination program at Sac County Public Health.
Mm-hmm. And just to clarify for folks, right, the vaccine effort previously was sort of run under emergency response. And now what's happening is that it's transitioning over to IAP, which to Lisa's point is sort of like the strategy is more of a sustained effort around COVID and other immunizations, which is, I think, a big win because it allows us to kind of think about it beyond just the emergency framework. Is that a correct description, Lisa?
Yeah, so while we were under emergency response, there was a special team put together to deal with, the pandemic, thinking that it's something that would disappear and we could just get over, but it's looking to be something of more of a chronic situation. So yeah, we've been slowly working on demobilization plans. So the people that were pulled to that special task force will return back to their regular jobs. And then what would normally be a task for the immunization assistance program will then fall to us. And so a little bit smaller teams, but we'll still be actively involved in the planning, and it'll just be part of our larger vaccination programs. So this was just some tables that I pulled just to show you the gap. So at the bottom left-hand corner is, you can see on the very far right is Q4, which are some of the more affluent neighborhoods, and their vaccination rate for boosters is at 68%. And so if we compare that to Q1s, which are only vaccinated at about 45%, there's actually quite a big gap. So we have a lot of work to do to get those people in Q1 and Q2 their booster vaccines. And then looking on the right-hand side, you can see that the overall vaccination rate in the Q3s and 4s are pretty high. And again, we need to help those folks in Q1 and Q2 get their vaccines. We're even still seeing people getting first and second doses at this point. So, and then just part of the governor's overall plan, it just recognizes that vaccinations are just one strategy of the overall COVID response. So, of course, getting your vaccine, boosters if they're to come, just making sure that people are masked, that they have the choice to wear one, education and awareness. There are a lot of campaigns through the state. We have social media campaigns as well, just to help, stop misinformation or disinformation. Readiness, just understanding that, there's a lot of planning involved in this, and that all of the plans that we put into place for COVID can transfer forward to any other future responses or pandemics, and just means that we'll be able to respond that much quicker. Testing has now been an important piece of COVID response, allowing kids to get back to school for in-person learning. And some people may not realize this, but there are some treatments for COVID. Should you have an exposure, should you be at risk, or should you test positive, there are some infusions and some oral treatments that are available for COVID, and that'll just be part of the overall response. And then I guess I have one last slide. And this is just an example of some of the education pieces that the state is working on and that we're also sharing as well. So some social media and some educational trainings.
Thanks, Lisa.
So, and I'm always available for questions. If anyone has any specific vaccine questions, or, you have something to add, if you have some comments about some of the locations we go to, or any feedback for me, feel free to reach out to me, and I'm
Any questions for Lisa and Rachel from Sac County Public Health IEP around kind of what they talked about so far?
Could you put the link to that crucial COVID-19 conversation campaign page in the chat? It's not active on the screen. Thank you.
Lisa, are you able to do that?
Let me see.
If not, I will send it out right after with some summary point notes.
You have to make chocolate ganache perfect for chocolate.
It's on the Google Doc.
Okay. All right, so just the follow-up is any feedback and questions from folks. I'm just going to summarize a couple key points that I heard from our panelists, which is the importance of community partnerships and the collaborations that we have with our community partners. Pfizer is going to be offered at all the clinics associated with the Partnership for People Experiencing Homelessness and People Using Drugs. There's the move that's happened from emergency response to IAP. So I am no longer a part of, I didn't say a part, but I'm no longer like coordinating this effort. This has moved over to Lisa Tarko and Rachel Allen, which is awesome. We are focusing on standing structured events. So they put the Loaves and Fishes, Harm Reduction Services, SANE, and we've seen some really amazing uptake there, particularly, which is the next bullet, around the importance of incentives and seeing how much incentives really change the game. And then the final update, Sacramento Steps Forward indicated that their CCHP 2.0, which was focused on encampments, is not going to be happening, but they provided some information on next steps around other resources that they are able to provide to partners for any general outreach. So those are kind of some key takeaways that I gleaned from this conversation. Is there anything else that folks feel like was missed that they felt like was a key takeaway?
I just want to say that having the increased teams here at HRS the last few weeks has been really helpful. It's really great to have additional staff coming from the county. Thank you.
Awesome, thanks, Leanne.
Liz. Oh, sorry.
Go ahead, Crystal, and then we'll go to Gloria.
I would add, is any of our outreach being put onto 211? Because like, not that I want to put more on 211 because it's messy, but I think that oftentimes that's where everybody's telling people to go for resources, like call 211 to get the information. So I don't know if there's any.
So yeah, essentially you're saying like, we want to make sure 211 knows about the standing events so they can tell people about that opportunity.
If that's, yeah, if that's a direction, because I just know anything when it comes to homelessness, they don't say like, hey, go to Heart or go here, go there. It's generally when people hit those encampments, it's call 211.
Okay, that's really helpful. Thanks, Crystal. We can definitely let them know about that. And then Gloria.
Yeah, I just wanted to comment on the added staff at SANE and Harm Reduction Services and Loaves and Fishes. At first, I thought, boy, this is much ado about nothing. You know, Gabby and I were doing it by ourselves. But as soon as the incentive program started and the numbers started to increase, I really can appreciate the streamlined setup that they have. They know what they're doing, and it really worked out well.
Awesome. It's almost like they foresaw there being a huge increase. Maybe Rachel and Lisa are kind of looking into the future for us, which is great. Thanks, Gloria. Anybody else have any thoughts on like some key points that they gleaned from this conversation that we should also make sure to share out with others that weren't able to join us? Okay. So the last item we have here on the agenda is just any feedback or questions. So I know, Crystal, you kind of led us into that space, which is great, around kind of the next steps of making sure 211 is at the very minimum aware of the standing events that are available. Does anybody else have any feedback, questions, concerns about kind of like where this effort is going from here that public health should take into consideration?
I guess I'll ask, are we still eligible to host private events like at a Heart Respite Center? Is that still a thing we can do?
And by that, you mean like send a request and say, hey, we want to have a vaccine event at our respite center, public health, is that possible? Is that your question?
Yes.
I mean, Lisa, you can speak to that, but I think we certainly have capacity. And I think if we come back with incentives, you might see better numbers. You know, if you're able to reach the population with that information ahead of time, it does seem like it's a pretty motivating incentive.
Yeah, I mean, our numbers have increased in the last couple of months, you know, for whether it's the winter or not, but typically on Tuesdays at St. John's, they're seeing, you know, upwards of 70 people. And at Fridays at Trinity, we're now seeing 35 to 38, where it used to be 20 to 21. And so I've got a broader audience now.
Yeah. Yeah, I mean, I think we're happy, right, Lisa, to add as we have capacity.
Yeah.
We often have additional staff that we can send to a smaller event like that.
Right,
Yeah,
cool.
absolutely. There's lots of options available. The state has some mobile teams that they can send out if you want us as a county specifically. We have partners that we're working with right now. We have a team of registry nurses through the state, and we kind of oversee them. So yeah, we have lots of different options depending on what your needs are. So yeah, feel free to connect.
Yeah, that would be great, because as somebody mentioned earlier during the survey thing, we participated in the survey, and as we already knew it, you know, Trinity Cathedral at 27th and Capitol might as well be Egypt from Loaves and Fishes. And so when I tell people these things happen to Loaves and Fishes, they look at me like I'm crazy, you know, because they just our group just doesn't go that far down the road. And so
Yeah, we're willing to meet them, you know, at the location that works. And there are other resources, but I don't know how many of them have incentives. So if that seems to be the thing that's really going to move the needle, then we probably will try our best to be the ones who come, just because we do have the incentives. And that funding is pretty persistent for me. And this is one group of people that they are working in. So I would at least encourage you, we're going to continue to bring incentives as long as we possibly can. And as long as we're seeing it move the needle with numbers and people vaccinated and safe.
And what should be the next step we direct folks to? Is there like a good email address, or like, should there be folks that are interested in those potential events?
Yeah, so I guess, our planning team meets weekly. So basically just looking at dates and locations and, what you expect, if you want all vaccine, what kind of numbers you expect to see, just an idea of what your needs are.
Mm-hmm.
You can reach out to either Lisa or I by email. We can put it in the chat.
Yeah, I'll put mine.
Okay, I can put mine too, just in case.
So I'll just tell folks to email both. So that way,
Sure. Yeah.
That sounds great. And then I'll include in the follow-up notes, just to make sure to include information that you noted, Lisa, which is like, do you have a sense of numbers, best time, location, etc. Awesome. Okay, Gloria, I'm sorry, did I skip you?
But I'm sorry, what, Liz?
Did you already share your thoughts, or did I?
Yes, yeah, I'm done. Thank you.
Okay, great. Any other feedback, questions, concerns that we want to lift up to public health?
Sure. I think this has been, sorry, this is like my only time to eat, so I'm eating lunch right now. But I think like decreasing barriers to COVID vaccines is really a cool example of how we can increase access to preventative health measures for people experiencing homelessness. And so wondering if we, like, thinking beyond COVID, like can we, start thinking about planning for, like hepatitis A, B, tetanus, all pneumonia, like all the other vaccines that exist in the world. Is there a way to decrease barriers to those as well?
Yeah, definitely. And, we're already going to be working with harm reduction on that. So our program does have the ability to order vaccines that are free for adults, kind of like we have already for children. And it does have to be administered through our program. So it would be a different team. It wouldn't be the COVID team coming out, but I do have teams that do that. And one of the things our program is tasked with is, working with those who are living outside to make sure they have hepatitis A vaccine, B, and like you're saying, Tdap, flu. And so that we're certainly motivated, and the connections that we've made through COVID are going to, I think, persist after the pandemic, and really, I think, better the care for all of our community, because we've met all of you, you've met us. And so, yes, we want to have those conversations, and my core team is already getting back to regular program work, and that will include this. So as much as we, have capacity to do it, we want to do it. We're not able to just hand over vaccines like we can with COVID and flu. It has to specifically be, administered by my program, but that's something we can do and should do. So yeah, let's keep the conversation going. And I know I had reached out to you a while back, MK, like, hey, would you take Hep A out with you? Or, because it is the perfect opportunity. So I think we need to get through the bump of how big these clinics are right now. It was, like you said, 70 vaccines or whatever at Loaves and Fishes is a lot. That was probably all the capacity that team had to do. But if we start to see more consistent numbers, I think we can start coming in with some other vaccines as well.
Cool.
We're going to talk about
That's
it
awesome.
tomorrow.
Yes, we are.
Yeah. Yeah. That's cool. Yeah. Cause was that Leanne?
Yep.
Or who was that? Oh
Yeah.
yeah. Cause I don't know, Rachel, if you know, Leanne and I worked together for years now. But through Joan Bateri, through Joan Bateri Memorial Clinic, which is the student-run free clinic that partners with HRS to provide care for folks living outside. So there is like many student-run clinics at UC Davis as well. So there's ways to like build in, because I know we don't have capacity to do vaccines as a student-run clinics, but could start building out. There's lots of easy avenues to plug in y'all's incredible work.
Yeah, and we could certainly set up clinics where we come and provide the vaccine. So we meet the state's requirement that we're housing the vaccine, but you bring the vaccinators, and, you know, we can work together with your student run clinic. I mean, I think I think there's ways to be creative about how we make this happen. So.
Yeah. Creativity. I love it.
Outreach clinic for sure.
Mm-hmm.
Yes,
Awesome.
and we actually do offer flu at our clinics as well. It's easy just to bring up flu so long as we still have it. So yeah, that's offered at all of the unhoused events as well.
All right, love the synergy. So yeah, the couple questions and feedback and ideas that came up was hosting events at our respite center from John. So we'll make sure to include the follow-up there. And decreasing barriers to COVID vaccines is just kind of a way we can think about building foundation for programs outside of COVID moving forward. So that's awesome. Anything else that folks are kind of chewing on as some last thoughts before we close out? Okay, well, I think that's it. Big congratulations to all the great work that has been done. You know, people who gave out 5 COVID vaccines when we needed it, or came for a one-day event when it was really important, and then folks that have been doing the work for 2 years. So every piece of it's important, and it builds. It like builds power, it builds momentum, and that's really great. That's gotten us to the place where we're saying, wow, we have 70 vaccines at the Loaves and Fishes Clinic. Like, that's really amazing. That's been built up over 2 years of great partnership and great work. So great work, everybody. And more to come from Rachel and Lisa from Sac County IAP, which, just as a reminder, is like the Sac County Public Health Program that's going to be kind of continuing this work in a more sustained fashion. And what I'm going to send out after this meeting is I'll convert it to a YouTube, send it out to everybody. We'll send out the key takeaways, who attended the meeting, and the feedback, questions, and concerns section, as well as the slides that we all discussed together. Is there anything else that we're missing? Okay, well, enjoy these 9 minutes back. And I'm sure we'll all be in touch soon.
Thank you.
Thank you.
Hi.
Thanks,
you.
everyone.
Thank you.
Bye.